In May of last year, the North Carolina Commission of Public Health approved new vaccine requirements and changes to existing requirements. The changes were made to more closely align the state's regulations and standards to CDC recommendations. April is a good month to be highlighting changes to the immunization program in Wake County because April is Adolescent Immunization Month and National Infant Immunization Week, which runs April 18th through the 25th. It's also a good time to alert medical providers, school personnel, child care centers, and parents about the changes. And to talk about those changes is JoAnn Douglas, supervisor with Wake County Human Services Immunization Tracking Team. Thank you so much for being here.
Thank you, Eric.
I guess the first question many would have is, why did the law change?
Well, as you mentioned, the law changed because the Advisory Committee on Immunization Practices in the state of North Carolina wanted to kind of sync up their recommendations to make it that we're all on the same page, and also to promote the health of the community. A better immunized community protects everyone, not just the patients that receive the shots.
What are some of the changes for school entry after July 1st of this year?
That's a good question. So as you mentioned, some are updates and some are new. So the updates include change to the polio vaccine requirement. So children entering school for the first time after July 1st of 2015 will have to have a booster dose of polio vaccine after 4 years of age before school entry for the first time. So for most children, that's going to be a fourth dose that they'll have to have after 4 years of age after July 1st. We also have a change to the varicella, the chickenpox vaccine. It was 1 dose was required. Now it's going to be 2 doses are required for children entering school for the first time after July 1st. Offers better protection, boosts that immunity up. And this is something that we've been doing in the health department and practices for a long time. So this is just a change to the law. 2 doses after July 1st. We also have a change concerning chickenpox about history of disease. Children that have a history of having had chickenpox disease are considered immune and they don't have to have the immunization. But in the state, we're going to increase the official documentation of that by requiring a physician, nurse practitioner, or physician's assistant sign a document attesting to that child's history of illness that includes the child's name, date of birth, and the date or the age at illness. So providers will be looking for that information. Schools will want that sort of documentation after July 1st school entry. There's one other change. It's pneumococcal vaccine. This is not about school entry. This is for children that are born July 1st of 2015 and after. So Prevnar is the pneumococcal vaccine that we're most familiar with, give lots of it. And after July 1st, it'll be required, just the same way as polio or diphtheria. So these children, when they get to school, they'll be looking for that in the schools and the child care. So children born after July 1st will be required to have Prevnar vaccine.
Okay. Are these changes only affecting school entry in the lower grades?
No. We have a couple of changes to the middle school law requirements, and the Tdap vaccine that we've been giving to 6th graders for the past few years is going to move up to the 7th grade. So we're going to have a 7th grade Tdap requirement. Children that have not had a Tdap before will have to have one, regardless of what other tetanus-containing vaccine that they've had. Tdap will be required for 7th graders starting after July 1st of 2015. And there's going to be a new requirement for middle school students entering the 7th grade. Meningococcal vaccine protects against the meningitis disease, very contagious, can be deadly in some cases. Children entering the 7th grade after July 1st will be required to have a dose of meningococcal vaccine. So that's a new requirement.
Now, the question some would have, some parents of middle schoolers, those that entered 6th grade this year had to get this shot.
Correct.
Going to 7th grade, will they have to get an additional Tdap shot?
It's an excellent question. Children that have already had a Tdap for this year don't need another. They only need 1. So for those that are rising 7th graders for this school year, most of them will only need the meningococcal vaccine, which is a good thing. And unfortunately, the Tdap and the meningococcal vaccine can be given together at the same visit if it's needed.
Okay, great. Are there any other changes to the law?
There is one more change. It's affecting a meningococcal requirement for high school students, but that's not going to begin until the year 2020. So the students in the 7th grade right now that are going to receive their booster after July 1st will have to have another dose when they're either 17 or a senior in high school, 12th grade, whichever comes first. That will help protect them as they move on to college and the workplace.
Are there any exemptions to receiving immunizations?
There are. North Carolina law allows for 2 exemptions to immunization: a medical exemption, which would be if a child was allergic to a vaccine or had some condition that a vaccine would be dangerous. The provider would make an application to the state medical director for that. And we also, in North Carolina, allow a religious exemption to immunization. Parents write a statement attesting to their religious objection to their child's immunization, including the student's information that is submitted to the provider and to the school. So both of those exemptions allow students to remain in school even though they don't have an immunization record to provide.
And where can parents get more information about immunizations and the new laws?
It's all on our website, wakegov.com. Type immunizations in the search box, and there's lots of immunization information, all of it updated to accommodate this new law, because we want parents to get in early and be prepared so they'll see what's required for their child coming up into the next school year.
JoAnn Douglas, Supervisor with Wake County Human Services Immunization Tracking Team, thanks so much for being here.
Thank you.